Hi, Dr. Rucker here. I'm going to review intramuscular injection techniques for testosterone. First of all, you'll get a bottle. It will look like this. Pop the plastic top. Rarely there's a metal top. You have to peel the metal off, but the needle has to go through rubber. Next thing I'm going to show you is, you can see here, that's the needle that either an 18 gauge or a 20 gauge will come with this on a 3cc syringe. So in that situation, you're drawing up the testosterone with the syringe and needle attached. And then you're going to switch to the narrow needle, which usually is a 23. This is probably a 23. And you're going to go intramuscularly. So the next part of the video, I'm going to show you some anatomy that I will summarize other good videos and graphics. Here's a video I like with some good graphics. I'm going to hit play and narrate it. First of all, you can see you want to select the proper site to avoid their nerves. The sciatic nerve runs pretty much medial and the downside. So guess what? You want to inject on the outer quadrant. So let me hit play.
Risk in the buttock injection. Buttock is divided into quadrants. Divide the buttock halfway down the middle and halfway across. Injection is given in the center of the upper outer quadrant.
Okay, so straight in, upper outer side. The hip bone's right here, so it's really just the upper out right next to the hip bone.
Injection into the other quadrants may cause injury to the neurovascular structures. Do not inject into the other quadrants. You may damage the sciatic nerve. Another helpful method could confirm a safe site for your injection is to draw.
And the last thing I'll say is you don't really have to pull back to see if you have blood. It's easier just to inject and go for it. And I like the patients to inject, and then they can take even a tissue and massage it in. You can use alcohol, or you can even use a wet wipe to clean the area. I'm going to look for a deltoid injection video. Okay, here's a nice little video on the deltoid. See, the acromion's a bony structure that runs over the top of your shoulder. Everyone knows the lateral part, the side-facing part of the shoulders is soft. So there's a whole triangle here. If you go too much to the front, you could hit the artery and nerve. So this got to be one of the easiest injections to teach. They're going to suggest you can figure out a way to do a triangle. I just go smack dab in the middle, but you'll see their little technique in case you're unsure.
Along the bottom of the acromion process to serve as the top of an inverted triangle. Using your other hand, make a peace sign and use this to make the other two sides of the inverted triangle.
So in this video, they're doing a lot of work for a simple process, but if you're really unsure, there's a little tip. So with these intramuscular injections, you can pretty much bury the needle. There's nothing you can harm. And I hope those two videos help you with self-injection. And the last thing is, yes, you can do the quadricep right in the middle of your upper thigh. I just find that's the most painful site. If a patient really wants to, we can guide them through it. But here are two nice little quick summary videos on deltoid and gluteal to get you going. And as always, our team is available from Reverse Medicine for more detailed questions, etc. Thank you.